Hi everyone, I'm your fave nurse B. Thanks a lot for coming back to my channel. Make sure you like, comment, and subscribe. If you're interested, go ahead and check out my second channel. It's a lifestyle channel. I talk about my pregnancy, my daughter. I do vegan and vegetarian videos. If you find my videos helpful, you should definitely share this with a friend, a classmate, teachers, your homegirls, your homeboys, anybody out there. It really helps to grow my channel. Also, if you find them helpful, go ahead and donate. You can just give $1 to my PayPal account. Basically, what I'm looking to do is to get half my subscribers to donate $1. It will help me to go back to school for my RN. Currently, I'm LPN. I have all my prereqs done for RN school. I just got to get this money paid off. So if you want to help out a little bit more, definitely donate to my PayPal account. But watching my videos and commenting and liking really helps me as well. So I definitely appreciate it. So let's get into this video. I know a lot of you are going to be graduating soon, or you just want to learn more about NCLEX. You're like, oh my goodness, I got to pass that boards. So let's just do some NCLEX questions. And also this helps me to get ready for an RN program too, because I know I have to do the entrance exam before I get into a program. So this kind of helps me because I have not been in nursing school for 4 years. So we're going to do these questions. This is the book I'm coming from. And like I said, I graduated 4 years ago and I have not read anything since then. So let's look. For some reason, I'm looking at GI. Let's look at the GI system. A nurse is teaching a client about an upcoming colonoscopy procedure. The nurse would include in the instructions the client will be placed in which of the following positions for the procedure. Okay. So in order to answer this, you need to know what a colonoscopy is. Even if you don't know, you know what colon is, right? And then anything with the scopy is like an examination. So they're examining the colon. Let's see. What position do you need to be in to do this? All right, y'all. This is where it get a little... All right. Left Sims position, lithotomy position, knee chest position, or right Sims position. I think Sims is the same as like lateral recumbent, right? Is Sims the same, y'all? Don't get me. I haven't looked at positions in a long time. I know when you're on your right side, that's the best way to look at stuff, on your right side. Because when you give somebody like a suppository enema, they should be on their right side. So I'm going to go with the right Sims position. But even if you didn't know none of this, the knee to chest is basically, just think about it. You put your knees to your chest and you kind of on your back, and that's the position they want to go in. That's the same position you got to go in when you get a Brazilian wax. It's so random, I know, y'all, but I'm going to go with the right Sims position just because I know as a nurse, that's the same position we put them in to do the enema and suppositories. But for you all, you would just have to know your positions to know what's the best way to do this. I don't even know what the heck lithotomy is. I'm going to have to look that up. But that's my answer. I don't have any other explanation as to why I'm answering it that way. Alright, so a nurse is preparing. I'm doing the best I can, y'all. A nurse is preparing to perform an abdominal examination. The initial step would be which of the following. Oh, okay. So this is basically This is an assessment question. That's what they're asking you. So what's the first step when it comes to examining the abdomen? Do you palpate? Well, palpitation, which is touching it. Do you inspect, just looking at it? Percussion, where you like kind of like touching to make sure that certain it's like they say that you can tell like if everything is positioned the right way by percussioning it, because it'll feel hollow. It'll feel like, I've never percussioned anybody's abdomen, but that's just that. Or auscultation, which is listening. So I've always been told before you do anything, you look. That's the first thing, is you look. Because if you start doing all this other stuff, it could affect the examination. So say for instance, if you start palpating, touching all over it, you could be moving some stuff around. I mean, you're not going to move their liver to the other side. Like, you're not going to do that. But you could start trying to move, like kind of moving around their bowels and stuff like that, and you might not get accurate like examination. So I've always been told, I think palpation is like last. But anywho, inspection to me is the first one you do. You just look at it. Okay, let me look at their stomach. Do it look a little, bloated? Does it look distended? like they got some fluid in there. Is there bruising on the person's stomach? That type of thing. So I would say inspection first with anything really. All right, so the next one is a nurse provides instructions to a client after a liver biopsy. The nurse tells the client to, all right, so liver biopsy is basically they take a piece of your liver and they want to test it to see if it's cancerous, if it has disease, such and such and such and such. So first one is avoid alcohol for 8 hours. Remain NPO for 24 hours. If you do not know what NPO means, this will trip you up. This is why you need to know your like medical abbreviations, and then you have to know that medical terminology. Anywho, number 3, lie on the right side for 2 hours. Save all stools to be checked for blood. Avoid alcohol for 8 hours after a liver biopsy. I feel like it should be longer than 8 hours if you're going to avoid alcohol, because your liver, you know, what do you call it? Filters alcohol out of your body. So it makes sense if they just took a chunk of your freaking liver out that you shouldn't be drinking alcohol because your liver's not functioning, you know, exactly how you need it to be functioning. Remain NPO for 24 hours. To me, that seems kind of extreme because I'm sure before you got the biopsy, you had to be NPO for some amount of time. If you don't know what NPO means just like nothing by mouth. So you can't eat, drink, none of that. So I'm sure you had to probably be NPO for like 6 to 8 hours before you had the procedure. So that means you're going to be not eating for like freaking 30 hours. Like that just seems extreme. For more than a day. That one seems too extreme. I don't think that's the right answer. Lie on your right side for 2 hours. That don't make no sense to me either. Why would you have to lay on your right side for 2 hours after a liver biopsy? Save all stools to be checked for blood. I don't see what that would be an answer to. Like, what does that have to do with you having blood in your stool? I don't feel like that's the right answer. I'm going to go with the first one because I know alcohol is completely related to your liver. So I would say avoid alcohol for 8 hours. To me, that's the one that makes more sense because it's like directly correlated to your liver. Everything else kind of could be like, I don't know. So that's my answer. I'm sticking to it. When you got an answer, stick to it, boo. Okay. A nurse is caring for a client with a diagnosis of chronic gastritis. The nurse anticipates that the client is at risk for which vitamin deficiency? Okay. I gotta think about that for a second. Alright, let's go into it. So number 1 is vitamin A. Number 2 is vitamin C. Number 3 is vitamin E. And number 4 is vitamin B12. B12 is like the only thing that I know has to... I honestly have no idea how to go about answering this. I'm trying to think. Because gastritis would be like inflammation, right? So... ACE. I'm just going to go with B12. I don't know why. But I'm going to go with B12. It might not be right, y'all. It might not be right. I honestly have no rhyme or reason to answer it that way. This is one of those questions you just have to freaking know. Right, number 5. So a nurse is caring for a client after a Billy Roth 2 procedure. Billy Roth, whatever. On review of the post-operative prescriptions, which of the following, if prescribed, would the nurse question and verify? So, this is you're looking for the wrong thing. When you have to, like I said, understand what they're asking you prior to you even looking at the answer choices. They want you to find one of these things. If you see it, you know that's wrong. So you need to find the wrong answer. That's the right answer. All right, so leg exercises, early ambulation, irrigation of your NG tube, coughing, and deep breathing exercises. I would say coughing and deep breathing only because we know these are GI questions. And anything that has to do with like your abdomen, you want to not cough, because that puts a lot of pressure on your stomach. It can mess up some stuff you got going on with your stomach. So to tell this person to cough and deep breathe, that has to do more with your lungs and helping you to like expel stuff out of your lungs and to like really help you to like open up your air passages. And I just feel like that would be too much pressure on your abdomen after any type of like GI system procedure. So I'm gonna go with that one. Don't know if it's right, but that's what we're gonna go with. 1, 2, 3, 4, 5. Should we do a few more questions? Do a few more questions. All right. The nurse is providing discharge instructions to a client after a gastrotomy. Oh gosh, I'm tired. Which measure would the nurse instruct the client to follow to help prevent dumping syndrome? Okay, so you will have to know what dumping syndrome is. Now, I just so happen to know what it is, but just looking at like dumping syndrome, maybe you might think dumping, like what does that mean? Like you're something coming out of you? I don't know. Dumping syndrome is basically like your body is not absorbing anything, so it's just like it all just comes out. It just keep coming out, keep coming out. You just keep going. You keep running like it's just total diarrhea, and your body is not absorbing anything. You know, when you that's why people when they had diarrhea, like they end up having like they get like dehydrated and stuff, and they also need to get like replacement of like nutrition because like your body doesn't have the time to absorb the nutrients because it's just coming right out of you. So we need to know what is going to help them to not have this issue. Okay, so ambulate after a meal. So that means as soon as you eat, walk around. To me, as soon as you eat and walk around, that means it's going to help to come out even more. So eat and just lay down somewhere. It would be my thing. So I don't think that's right. Eat high carb foods. I don't see a problem with high carb food, but high carb food means to be a lot of sugar, and sugar can run through your system too. I don't know. I don't know about that one. Limit the fluids taken with meals. That makes sense because if you you know, the more that fluids that you take, it helps your bowels to move a lot better. That's why when you constipated, you really should be drinking a lot of fluids because it's gonna help you to get everything moving. So I can see that. Sit at a high Fowler's position during meals. High Fowler's is just like all the way up, like a 90-degree angle when you eat. I don't really think that has anything to do with dumping syndrome. I would say it'll be 3. Limit your fluids because, like I said, the more water you drink, it's going to come out of you. A nurse is monitoring a client for the early signs and symptoms of dumping syndrome. Here we go. Early signs and symptoms. This, again, we had this with our last questions when we did the renal system. Early. You need to look at those key words. Yeah, not just signs and symptoms. These are early signs and symptoms. So this is before the disease process becomes like extreme, you know? Okay, so a nurse is monitoring a client for the early signs and symptoms of dumping syndrome. Which of the following symptoms indicate this occurrence? Sweating and pallor, dry skin and stomach pain, bradycardia and indigestion, double vision and chest pain. I don't think it's that one at all. I don't think it's double vision and chest pain. That seems like that's some extreme, honey. You didn't let stuff go to the wayside for too long if it's getting to that point. Let's see. Sweating and pallor. That to me would be a late symptom too. Only because at that point you've probably lost so much freaking fluids out of your body, and you probably all messed up at that point. To the point where you sweating and you look like you like really sick, like your skin look kind of like white or really dry. I mean not dry, but like kind of like that grayish, like that sick tone to it. You know, that's what pallor is. Let me look up the exact word the exact definition for y'all. Because Nurse B could be just over here talking. It's a pale color to your skin. So yeah, like I said, that white, like kind of like grayish, like you just look sick, girl. That's what pallor is. Pallor. I feel like that's kind of late as well. Let's see. Dry skin and stomach pain. That dry skin throwing me off. Like, what does that have to do with anything? Could that be an early symptom? I feel like the stomach pain could be an early symptom, but the dry skin, like I said, that's dry. That's messing me up. Bradycardia and indigestion. Now, you might have bradycardia, which is low heart rate, because you're starting to, what do you call it? You're starting to, like, lose fluids. so you don't have enough fluid circulating. Because like I said, dumping syndrome is when everything just comes out of your body. You know, everything is just coming out. So, and then indigestion. Okay, let me think about this. I already said dry, double vision is out. Sweating and pallor. Dry skin and stomach pain, bradycardia, and indigestion. I also feel like bradycardia would be one of those last things. But the indigestion, I feel like indigestion should be an earlier symptom, right? Like, because if it's coming right out of you, like, you're going to be like, ugh, like your stomach's going to hurt. Imagine when you got diarrhea, you know, your stomach start hurting. Oh, but that's not necessarily stomach hurting, because dry skin and stomach pain is one of the answers. Let's go with that one. I've already said my stomach hurt because I got the runs. So I'm going to go with that one. If you got the runs, your stomach going to hurt. Now, bradycardia and indigestion. That bradycardia, I really feel like it's a late stage. So I'm not going to go with that one. So we did 1, 2, 3, 4, 5, 6. We did 7 questions. Let me get my paper. I want to cover up any questions that we didn't do. I want to cover those up. This one was, what position would you tell your patient to get into for a colonoscopy? I said the right Sims position, and that ain't right, girl. It's the left. Yes, why did I say right? It is left. Oh my goodness. Oh my goodness. Left lateral recumbent. Why the hell did I say right? Why did I say right? I have no idea why I said right. Dang, why didn't y'all tell me when I was giving y'all a freaking explanation? Left Sims. It has to do, like I said, it has to do with the anatomy. It's just easier for you to be able to see everything and get in there and do everything with that left side. So left Sims is the same as left lateral recumbent. I don't know why the hell I said right, but see, Nurse B got to get it together. Number 2 is a nurse is. Oh, okay. So what's the first thing you do when you're doing an abdominal examination? The answer was inspection, and I put inspection. It's saying you do inspection first, then you auscultate, listen to it, then you percuss, and then you palpate. Remember I said you do palpation later because, yes, when you palpate, it can, it says palpation is done later to ensure that the motility of the bowel and bowel sounds are not altered. Yeah, because if you moving it around, like you could, like I said, get a false reading with the bowel sounds. Anywho, let's see. This is the one where I had no idea. No, this is the one where we did a liver biopsy, number 3. I said avoid alcohol because that's the only thing I really saw that directly correlated with your liver. So let's see. No, that wasn't right. Number 473. Lie on your right side for 2 hours. So it says to splint the puncture site, the client is to keep on his right side for a minimum of 2 hours. It is not necessary to be Permission regarding alcohol consumption should be obtained from the healthcare provider. And it is not necessary to save stool. Like, to me, their explanation of this is off, because anything that you have post-op, any post-op orders are going to come from the doctor. So, of course, everything would have to come from your healthcare provider. So, just saying alcohol would, I don't know, y'all. Let's just move on. The next one was, which vitamin deficiency would you have with chronic gastritis? I said B12 just because I freaking, like, I don't know. I think with B12, like, I know, like, B12 is something that you have to get from food. You have to get B12 from food. You can't get it from the sun, unlike that. Like, you have to get it from what you eat. So, I just feel like B12 was the answer. I mean, I'm sure with a lot of vitamins, you have to get it from what you eat. I don't know, yeah. I just thought B12 was the answer. So, let's just see. Yes, it says B12 is the answer. It says because da 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 da. Oh, this disorder could lead to the inability of your body to absorb vitamin B12, which could lead to pernicious anemia. All right, so the answer was right. That was on a humbug. I got that right. Let's see. The next one is about that procedure that you had, and what would you tell your patient not to do? I said do not do coughing and deep breathing. So the answer for that, 475, would be, oh, the one that they said would be the irrigation of the NG tube. But this is crazy. So it says that they do the NG tube, and it's critical to make sure that you have patency, to make sure it's open. But the nurse would never irrigate without orders from the doctor. Well, but you're saying that you looking at orders, and what orders would you have to verify? So, of course, you would get orders from the doctor before you did it. That was a weird explanation, y'all. Like, that's weird as hell. But my whole theory with the coughing and deep breathing wasn't the case. That's really weird. It's saying that it would be the NG tube, irrigating the NG tube is the one that the nurse would be like, that's not right. I would question that. Is because the reason behind saying why they would question it is because you would never irrigate an NG tube without a doctor's order. But the question is saying that you're looking at the doctor's orders. So it's saying, like, on review of the post-operative prescriptions, which of the following, if prescribed, would the nurse question and verify? Like, that's weird to me. I guess they're saying, like, the nurse wouldn't, I don't know. Y'all tell me what y'all think they coming off with that. Do y'all get what I'm saying, where, like, this doesn't make any sense as far as why they're saying a rationale behind it? But we're looking at dumping syndrome, and we're saying, what should the patient avoid to help prevent dumping syndrome? I said, limit the fluids taken with meals. Okay. And the answer was decrease the fluids taken with meals. That was correct. And it says lie down for 30 minutes after meals versus going to walk. Remember I said I think walking after meals will help you to get all that out. And it say you should be in low filers instead of high filers when you eat. That makes sense because the more you sit up, like, you help your body to get everything out. And if you can kind of lean back a little bit and eat, that will take a little bit more time for your body to digest. When you sit all the way up, that helps everything to digest. At this point, you don't have a problem with things going through because it's going to go through super fast. You have a problem with it going through super fast, so you want to kind of put yourself in a position that's going to make your body slow down and absorb the nutrients before it expels itself out of your body. All right. Now, these are the early symptoms of dumping syndrome. So that answer was, I put dry skin and stomach pain. They're saying sweating and pallor was the first one. That's interesting. So it says early manifestations occur 5 to 30 minutes after eating. Symptoms include vertigo, tachycardia, syncope, sweating, palpitations, and pallor, and the desire to lie down. No idea. Didn't even have that. I didn't even think that was the answer. But anyways, that's what we got. We probably got, I don't know how many out of how many right. That's Nurse B reviewing NCLEX questions without me reading the information, just going off the top of the dome and kind of using critical thinking and just reasoning. But like I said, thanks again for watching these videos. I know they're a little bit longer than my other videos, even though my videos are already long to begin with. But thanks again for watching. Let me know if you like them, if they're helpful, and if you have any other suggestions as to how I can do NCLEX questions for you all. Let me know. Like, y'all know I'm down to do pretty much whatever y'all want me to do. So with that being said, I'm tired. My throat is dry. It's like freaking 12 in the morning. It's 1 o'clock in the morning. I gotta go. Bye. I love you. Peace.